What is a CTG? It's a computed tocography. It's a test beyond ultrasound, which we do especially to monitor the babies in the pregnancy or in labor. It is picking up the heartbeat of the baby because it fluctuates throughout. It fluctuates when the baby moves, when the baby is sleeping. So we are monitoring the baby's heart pattern along with its autonomic and nervous system. So this is a beautiful test that we start doing for specific conditions. So if you're not in labor and you're pregnant, it's not offered to all. It's offered to some patients, like if they come with reduced fetal movements, we do this test to see if the baby's fine. We do this test if you are a high-risk pregnancy in the ward admitted for something. So it becomes a part of fetal monitoring when you are admitted in the hospital. If your baby is not growing so well, you might be called in often by your doctor to do this test, sometimes weekly, sometimes alternate days, depending on how your baby is growing inside, because it really gives a very specific, like it literally shows in this 20-30 minutes the baby is okay. And if it has been okay, it stays like it can stay okay for the whole time. So it depends on the risk factor that you are having. In labor, we don't do CTG continuously for everyone, especially a low risk patient who doesn't have any risk factors. We will not do this. We will do an admission CTG, which is basically look at the baby for like 20-30 minutes. If it has been overall okay, good size baby, no other risk factors, we will not put you on this machine and keep you in monitoring continuously. We want you to move around and try to deliver naturally while simultaneously listening to the baby's heart rate. Just listening with like a Doppler. But if you're a high-risk patient, like you are on an epidural, you are leaking for a long time, you have fever, you have high blood pressure, your baby is not growing so well, you have diabetes in pregnancy, you have bleeding in pregnancy, many such risk factors, you will be on a continuous monitor throughout labor. Now, this continuous monitoring has advantages and disadvantages, because if things go wrong on it, sometimes we are leaning on doing a cesarean section, and the evidence still doesn't say that it's so beneficial, but yet we do it. We do it because that is the clear-cut evidence of how the baby is doing inside. And it becomes evidence in the court of law that this was going on. See, when this happened, when the baby's heart rate was dropping, we took the baby for cesarean section. And suppose our cesarean section or instrumental delivery, once you deliver or you have a cesarean section, they will check the gases in baby's cord blood, as in they want to see how was the oxygen supply in the blood of the baby, so that the baby's brain was getting oxygenation, because that is something which we want to avoid. Because when things go wrong in labor is because suddenly the blood supply to baby stopped, which compromised, like baby's brain didn't get blood for like 3-4 minutes, which causes damage, and that can cause cerebral palsy or mental retardation associated with birth asphyxia. We don't want that. And the whole monitoring for 9 months for the mother and the baby is purely because we do not want to give you a baby which is brain dead, or which is compromised in brain function, or which is or we don't want to lose our baby. We want the baby to come out crying. So this is CTG. Now, this is like a very short video I made around CTG, and there I can talk for hours and hours and hours because we are trained in CTG so much. But let me know what you think. What are your doubts around it? If there are some more, bring it to the call. We can talk about it, or email me, message me. Let me know, and I can make some more videos around it.